This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm discussing knee injuries in dogs. How to tell if your dog has ruptured his anterior cruciate ligament. Well, the first clinical sign is your dog is going to be lame. Typically, most dogs partially tear their ligament. A number can completely tear the ligament. But the first sign is your dog is either partially putting weight on that left or right rear leg or not putting any weight on it at all. You may see your dog sitting with one sort of leg sitting out to the side, similar how Lewis has had right there. The ruptured cranial cruciate ligament is the most common knee injury of dogs. So in most cases, when clients would phone in or come in, it's their dog has had a sudden injury and they're just suddenly non-weight bearing. It can be quite painful. So if you imagine you've completely ruptured that ligament, it's very sore and painful. So that typically would warrant a pretty immediate veterinary visit. Or in other cases, there can be a partial tear where part of the ligament is torn. A client's own dog is then able to still bear weight on that leg, but it's still fairly sore, and then it can progress as the knee is unstable. It can then progress to a full tear, or you can have inflammation along with accompanying arthritis. Before we go into the diagnosis, I wanted to next give you a better understanding of the anatomy. I'm showing you a model so then you can get a better sense of what it really means if your dog has been diagnosed with an anterior ruptured cruciate ligament. So let's look at this model here first. And what you're looking at first, the big bone on top here, this is the femur. The smaller bone here, this is called the tibia. This ridge is along the top here. Right there is called the tibial crest. This smaller bone here, what my index finger is on, that's called the fibula. We're looking at the knee itself. So this big ligament that I'm hanging on to that runs along the top, that's called the patellar ligament. And inside that bone I'm touching right there, that's patellar, that's your kneecap. And either side of it, there are a couple of different collateral ligaments. So here, we're looking at that. This would be the lateral collateral ligament, runs on the lateral side of the knee. Here is called the medial collateral ligament. It runs on the medial side of the knee. Then let's just open up the knee itself. So I'm pulling the kneecap right down. So you're seeing inside of it, and I'm bending it. So in there, you can actually see these two ligaments that cross themselves. That's where they're called the cruciate ligaments, because the ligaments actually form a cross. So the cruciate ligament, it runs from the medial portion of the lateral femoral condyle, so right in here, this chunk, this big bone, the femur, this ligament here, and it inserts, and then it goes cranially, inserting onto the tibial plateau. So here it is, my finger following that. So that's the cruciate ligament. And underneath it, you can see this other ligament that goes across, goes backwards. That's called the caudal cruciate ligament. It's less significant in veterinary practice. We seldom see it injured. Primarily what we're dealing with is this cranial cruciate ligament running here. So running from the lateral condyle, running forward and inserting up here, immediately onto the tibial crest. So there is that cruciate ligament itself. Underneath the cruciate ligament, you actually see these big sort of bubbly looking structures, and these are the menisci. They're the shock absorbers. Now I'm going to discuss them later as part of the video in terms of the diagnosis and the importance of them, because they are clinically very important. So when the ligament is ruptured itself, what's happened is either there's been a force, some type of force put on the knee itself. Your dog could be running, he plants his foot, the rest of his body goes forward, tear, he partly tears that ligament. Typically, or perhaps he's been hit from behind. He's been playing, another dog hits him, tears it. Other cases, we can just be dealing with these dogs that have very almost straight legs. Their conformation isn't ideal, making them much more prone to knee injury, and it can just take a sudden force or maybe even a twist. And when that knee can twist itself, it's not fully supported, then you can have that ligament partially tearing or completely tearing itself. So looking at it, I think you should get a pretty good sense of what that ligament looks like in terms of how it is in there. And this actual model gives you a pretty good, clear example of where the ligament is located, how it looks, and then perhaps you can then have a better sense of what it means. So I want to show you on Lewis here, his knee and specifically how we go about diagnosing cruciate ligament injury in dogs. So this is Lewis's left leg here. I'm just bending it up and down. This is his knee here. My right hand is over top of. And what I'm doing, I'm just grabbing onto the lower joint. This is his hop joint. So this is his tibia that runs here, the knee itself. And underneath it, when I move it, you can feel this little bone moving back and forth. That's the kneecap. The big bone up here is the femur. So the particular diagnosis of cruciate injury in any dog, like the diagnostic test, is something called the drawer sign. And what that means is the ligament has been ruptured itself, and it's preventing forward motion of this bone, the tibia, in relation to this bone, the femur. And if you can imagine itself, so what we're actually seeing in a cruciate ligament rupture, so this bone here is you're grabbing on, I'll grab onto this big bone up here, the femur, and I keep it solid and stable. And then what I'm doing is seeing if I can push this, I grab onto this top bone here, the tibia, and if I can move the tibia forward in relation to the femur, I've got a thing called a drawer sign. Lewis has no drawer sign. He has a solid intact cruciate ligament, fortunately. So that is the diagnostic test, and that's classic, and that's how you diagnose cruciate rupture in dogs. I also want to demonstrate on the model here and show you the similar thing, what the actual drawer sign is. So if you remember before, this bone here is the tibia, the lower one. The big one above is called the femur. That's the femur. And I'll open it up so you can see. And that ligament that my finger's on right there, that's the cruciate ligament. So when it's ruptured, and the diagnosis is there's a drawer sign. So that means I'm firmly hanging on and anchoring the femur, and I'm pushing that tibia forward. And you can see a little bit of movement forward, and that's the drawer movement, or the drawer sign. When that ligament is completely ruptured, I'll have that move forward upwards of an inch. There's a couple other things I wanted to explain with the model and then show on Lewis as far as being able to diagnose cruciate ligament rupture in dogs. One, there's something called a medial buttress. In this area, this is the medial part. So this would actually be the left leg. This is a left leg model, similar to what we're looking at with Lewis lying on his side. So this is the outside, the lateral portion, you can tell because that's where the fibula is located. And this is the inside, the medial side. So the buttress is where you actually have scar tissue building up all along here. That's called the medial buttress. In Lewis here, if I were to see a medial buttress in Lewis, I'll hold him up. I will actually feel this increased amount of tissue all in the inside part of his knee. And that's what happens long term, is how your dog is able to ultimately stabilize the knee itself. Think of it, he's building up scar tissue, especially on the inside, also on the outside, and that's what's keeping that knee stable long term. One of the other tests I would do in veterinary practice called the tibial compression test. And what that means is I would hold sort of the femur up, the leg up sort of laterally if I'm having a dog lying on the exam table. Then I would extend, hanging onto the hock, I would extend that leg straight. And by doing that, I'm actually causing the knee to close on itself, and it's actually putting pressure on the menisci. And if there is if there's a positive tibial compression test, this would be painful in these dogs that have had cruciate ligament injury, and they'll react, and they won't let me do it, or it's very painful to do it. I'm also just going to show you here with the model what that means, the tibial compression test. So here's the leg lying at the side, you can imagine it, and what you're doing is you're extending the tibia, and you're actually compressing. So you can actually see there's a gap right now when the knee is partly bent, somewhere between 30 to 45 degrees. You can see that big opening, and you can see that opening between the femur and the shock absorber padding. That's a medial menisci. So when I close that down, when I compress that tibia, extending the leg straight, I'm causing the femur to compress the menisci. And if the menisci is injured in any way, that's very painful, and your dog's going to react and not allow it to happen. The last thing I want to show you in terms of diagnosing cruciate ligament rupture is palpating the meniscal click. So in some cases, this big area right in here, there is the medial meniscus, for instance, and here's the lateral menisci. They're damaged. They can be cut. Sometimes they can actually be folded in on themselves. It's not uncommon for the medial menisci back here, the very back of the knee, to be folded in where it's actually lifted off from the base of the tibia, and it'll fold in on itself here. So when your dog moves his knee up and down, that menisci will actually compress on itself, and that's very painful. So if there is a meniscal injury, it's not uncommon to actually be able to move the knee up and down like this, and you'll actually feel this clicking noise. That's another one of the diagnostic tests. So if you are moving your dog's knee, compressing, extending and flexing it, and you're feeling this clicking noise, that's suggestive of a meniscal injury. Just want to show you on Lewis here how I would be palpating to see if he's got a meniscal injury. And I'm just gently elevating his left leg, and I would just extend and flex that knee with my palm right over top of the knee itself, and that lets me feel the knee itself. If there was a meniscal injury, I would expect that one, it would be uncomfortable. He wouldn't necessarily let me extend and flex it so easily, and two, I'll often just feel this clicking noise, click, click. I'm not feeling that, he doesn't have an injury, but that's what you may feel if your dog had injured its ACL and has a meniscal injury. Thank you for watching this edition of Veterinary Secrets. What I want you to do now is click that link above. You can subscribe to my channel, and then when you sign up for my newsletter, I can send you my free books and videos on how to heal your pets at home with my top natural remedies.